Today we're going to talk about blood pressure, but maybe in a way you haven't really heard before. We're going to go beyond just the numbers on a cuff and really explore the deeper story, what's actually happening inside our bodies over the long haul. And truly understanding this, well, that's the key to protecting your heart for years to come.
You know that quiet moment? Maybe you're sitting in the doctor's office, or you're doing a check at the pharmacy, and you see that number on the blood pressure cuff, and it's a little higher than you remember. It's not a panic moment, but it's a pause. You get this feeling of, okay, what does this really mean for me? What's the story here?
And that's exactly the question we're going to get into today. Because those numbers, they're really just the start of the conversation. They're signals. The real story, the one that truly matters for our long-term health, is about what that pressure is physically doing to our bodies day after day. This whole conversation isn't about fear, it's about getting clarity.
Okay, so first things first, let's get our bearings with the official numbers. This table from the American Heart Association lays out the standard categories. You can see normal is less than 120/80, then you creep into elevated, and from there into hypertension stage 1 and 2. This is a really useful map. It gives us some context. But a map isn't the same as the actual terrain, right?
And that brings us to the real heart of the matter. What is that pressure actually doing inside your blood vessels? What's the physical story that's playing out silently, day in and day out, behind those numbers?
The easiest way to think about this is with a little comparison. A healthy artery is kind of like a brand new, flexible garden hose. It's responsive, it expands and contracts with no problem. But an artery that's been living under constant high pressure for years, that's more like an old weathered hose that's been left out in the sun. It gets stiff, brittle, and the walls actually get thicker, which narrows the opening for blood to flow through.
And there's a scientific name for this process. It's called vascular remodeling. This is so important. It's the slow physical change to the very structure of your arteries as they try to cope with that long-term force of high blood pressure. This right here, this is the hidden story that's so vital to understand.
So how does this remodeling actually happen? Well, it's a process called maladaptive remodeling. That's just a way of saying your body is trying to adapt, but the changes end up causing more harm than good in the long run. First, you have that constant pressure creating stress. The body responds by making the muscle cells in the artery walls grow and rearrange. Then the artery's whole support structure gets rebuilt, but it's rebuilt improperly. It becomes stiffer. And the end result, the artery wall gets thicker and the pathway for your blood gets smaller. And right there, that's the why. That's why this isn't about freaking out over a single high reading. It's about consistent long-term management to slow down or interrupt this internal remodeling process. It's about protecting the flexibility of your arteries.
And I really want to emphasize this point. This whole vascular remodeling thing, it is a marathon, not a sprint. It doesn't happen because of one stressful week. It's the result of pressure over months and years. And you know what? That's actually good news because it means that consistent, steady efforts to manage it can make a real physical difference over time.
So why do we care so much about this remodeling? Well, because that stiffening and narrowing doesn't just happen in one place. It happens in blood vessels all over your body. It affects every single organ. And in large observational studies, researchers have seen that over many years, this process is associated with a higher risk for things we all want to avoid, like heart attack, stroke, kidney problems, and even cognitive decline.
This quote just nails it. The connection between high blood pressure and these health problems isn't about one number on one day. It's about the cumulative effect of that internal remodeling happening over the course of years. This idea completely changes the focus from short-term anxiety to a much more sustainable, long-term strategy of care.
Okay, so knowing all of this, the next logical question is, all right, what do I do about it? How do we move from just being a passive person getting a number read to them to becoming an active, informed partner in managing our own health?
The real goal here is a kind of identity shift. It's about starting to see yourself not just as a patient, but as the primary advocate for your own health. You become the person who understands the why behind the advice and can have much better, more productive conversations with your healthcare team.
So what does that look like in practice? Well, it can start with just gentle observation. This isn't about judging yourself, it's just about getting curious. Start noticing your readings at home. What happens after a salty meal? Or after a really stressful day? What about after a nice walk? Just start looking for your own personal patterns. You can become the world's leading expert on your own body. And when you're armed with those observations, you can have a totally different conversation with your doctor. Instead of just, is this number bad? You can start asking really targeted questions. Given the patterns I'm seeing, what does this mean for my personal risk? Or what are the 1 or 2 lifestyle changes that will be most impactful for me? It changes the whole dynamic into a true partnership.
I think this is the perfect way to look at it. The goal is never perfection. It's impossible. The real goal is understanding what's going on inside your body and then making steady, consistent progress. That's what really moves the needle on long-term health. And it's so important to remember, you are not in this alone. This is all about building a strong partnership with your healthcare team. You bring your expertise, which is your day-to-day experience in your own body, and they bring their medical expertise. And together, you figure out a plan that actually works for your life.
This content is for educational purposes only and is not medical advice. Every individual's health situation is unique. Always consult a qualified healthcare professional before making decisions about your health.
So I'll leave you with just one question to think about. Not some huge, life-altering change, just what's one small, steady step you can take this week to understand your own health story just a little bit better. Thank you so much for watching.